Okay, so we extracted your tooth today. So I have some instructions for you before we have you go out. So right now you're numb because we gave you a lot of anesthetics. You don't feel anything. You're gonna be numb for about 2 to 4 hours. That's completely normal. Just be careful not to accidentally bite your cheek, your lip, or your tongue. Also, there's gonna be some bleeding, pink or blood, saliva. That's pretty normal. If it starts bleeding, you have gauze in your mouth right now. You can put a little pressure on that to try and stop the bleeding. If the bleeding doesn't stop after 2 hours, give us a call because that's not normal. Also, you're gonna, as for the surgical site care, we're not gonna have you like try to look at it, pull back your cheek with your lip or with your finger, and just don't poke at it or anything. And try not to, avoid mouthwash tonight. Make sure you don't do that, or vigorously brush or anything like that. And tomorrow, if you're feeling up to it, you can use a cup of water, warm, not hot. Mix a teaspoon of salt in with it. Mix it around, and depending on whether or not you have absorbable or non-absorbable, if you have absorbable, you're going to be fine. You don't have to come back in. If you have non-absorbable, we're going to have you come back in 3 to 5 days, and we're going to remove them. If your sutures come out in 2 days or 48 hours, please call us because that is not normal, and we'll get that fixed. As for your daily activities, don't try to avoid, if you have to go back to work today, try to get light duty, try not to do anything too strenuous. Tomorrow, if you want to go back at your own comfort, to try and build up, so try not to run a marathon or anything like that. And as for your diet, right now you have a blood clot in where they took that up, so no straws, absolutely no straws, and you can have cool, non-carbonated drinks, preferably, and soft foods. So, Jell-O, ice cream, and cream of wheat, or pudding, just very soft foods. And you can start returning back to normal tomorrow. Just slowly, gradually get into that. As for your pain, you're going to have some, that's pretty normal, so you can take acetaminophen, Tylenol, or ibuprofen, Motrin, and just read the bottom to make sure that you're taking the correct amount, and if it doesn't get better in 40 hours, let us know. And as for oral hygiene, you're not going to brush the area or floss or anything like that. You're going to be super careful. You're not going to poke or prod at it, and just be super careful. And today we're going to send you home with a prescription, and just follow the instructions. Might get some chlorhexidine or some antibiotics to help, so just make sure you follow those. And also you're going to get me swelling, which is pretty normal. For 20 minutes, for the first 24 hours, I want you to put on an ice pack, 10 minutes or 20 minutes on, 20 minutes off, and after the 24 hours, put on hot compresses for 20 minutes, 20 minutes off. If the pain or the swelling doesn't get better after 2 days or 48 hours, call back. That's not normal. Also, there's a condition called dry socket. You'll know if you have it, where the blood clot does form, and if you take care of it, usually you don't get one, but even people who do take care of it get one. This usually happens after the 35th day, and you can come in and we'll give you some medication for that. But like I said, you avoid straws and avoid smoking, that sucking motion will cause a clot. And if you have a fever, that's perfectly normal too. Fever of 100.5, not 105, 100.5 Fahrenheit. That's normal for the first 48 hours, but if it keeps not going up and not going down, give us a call. So. And do you have any questions for me?
No.